destacar que día 17 de abril fue agredida una compañera enfermera.
On April the 17th, there was an attack on a colleague, on a nurse, and she was attacked in a brutal way and absurdly, in an absurdly brutal and aggressive way, and she had important lesions. She's out of danger now, but we know that the aggressors, a man and a woman, were detained and they have been put at the disposition of the authorities at the public prosecutor's office. And we have a video in which the prosecutor herself talks about this case. Ernestina Godoy, who is the public prosecutor for Mexico City. Good evening, everyone. Deputy Secretary Dr. Lopez Gatell and all of the other public officers and people present at the conference. I will be relating the events regarding the attacks on this nurse. This attack was registered at Gustavo Amadero, and after receiving the report, we began an investigation aimed at punishing the aggressors. As a result of our investigations, the Prosecutor's Office of Mexico City solicited and obtained information regarding the two suspects and then proceeded to present public charges against them. These two individuals are in prison now and they are awaiting their audience, their hearing. Sorry, they're waiting for hearing to begin with their process. It is completely unacceptable to have these aggressions happening. Nothing justifies them. I want to be very clear. There will be no impunity for this kind of acts, and the prosecutor's office will be relentless in their punishing and their convicting it, and it's convicting of these kinds of aggressors. We have to be united to protect all people who dedicate their lives to taking care of our sick patients, and especially amidst a pandemic such as this one, in which all of us are vulnerable. The Mexico City government and the prosecutor's office will continue to monitor this case, and we are available to the public through the online platforms and to the telephones that you all know for anything you need. Well, thank you very much, Ernestina Godoy Ramos, for the fast acting in this unfortunate case, and we hope that all members of the public health sector and all the community and all of us, I think we are waiting for the swift resolution of these attacks and that the aggressors are punished accordingly. And I really hope that all over the country, the different local and state level prosecutor offices will be dealing with these events in a fast and efficient way, because these kind of aggressions cannot be tolerated. Let's begin with the technical daily report that will be presented by Dr. Alomia, and after that, Dr. Cortez will be presenting some new elements regarding the monitoring of public space mobility, and he will share with us some other resources that are important as well.
Muy buenas noches con todas y todos.
Good evening, everyone. Let's begin with the daily technical report.
Primero presentando lógicamente el calendario que lo empezamos a presentar desde el día
Now,
de ayer,
since yesterday, we will be presenting this calendar to have a visual
actividades y
take
estrategias
on the different achievements and the development of these strategies throughout the length of the National Safe Distance campaign. We know we still have over a month on the way before we can complete this national campaign. We are at the middle, more or less. Here we have the international update. If we focus on the percentage that we have been focusing on, we see that it has continued to decrease. It's at 42% now, which is the percentage of active cases worldwide. And the relation between the Americas and the European region in regards to the representation in active cases through this chart is more or less the same than yesterday. We haven't observed some great variation. And this is because the decrease has been rather slow in the European region, and the increase in the Americas hasn't been that fast either. Remember that the most overrepresented country from the Americas region currently is the United States, which has the highest number of cases in our continent. Next slide, we have an update regarding the numbers. Up to now, we have 12,872 confirmed cases, out of which only 4,502 are active cases. So only a third of the confirmed cases are actually active right now. We have 7,889 suspect cases. This is a cumulative number, meaning, and these suspect cases could be and will eventually be either confirmed or denied. Unfortunately, we have 1,222 fatalities so far total, and we have 41,573 negative results in total since the pandemic began in our country. Here we have the cumulative burden of disease, meaning the total number of cases that have presented in our country. These 12,872, how are they distributed per state? And of course, this is presented through a color scale, and the green areas being the ones with lower concentrations, and the reddish, almost brownish areas are the one with the highest concentrations. This same data can be observed in the form of a bar graph, so you can have a look at the total numbers, at the raw data. Each bar stands for a state, for a different state, and we can observe the total number of cases per state at this chart. Of course, this is related, the number of cases, of confirmed cases in each state is directly related to the population of such state. Next slide, we can observe the active cases distribution per state, meaning the active pandemic in our country. So We also have a color scale here, and lighter green means lower concentration, orange and red means a higher concentration. Here we have the same information presented in the form of a bar graph, but it is really the next slide, the one that we can use to make a fair comparison, because this that we are presenting right now is the is the active case incidence rate. And remember, the incidence rate is calculated with relation to the population of each state. So we are presenting the average number of cases per 100,000 inhabitants per state. So the states that appear in darker shades of green are the ones that have a higher transmission rate because they have a higher incidence rate. The same distribution appears now in the form of a bar graph, and we can see which states have a higher incidence rate and which one have a lower incidence rate. So this, if we take into account the population as we are in this chart, we see the distribution changes a little bit as compared to the one that only takes into account the total number of cases. Now here we have the information related to the fatalities. They appear presented as per the date of the death. Of course, the blue bars refer to confirmed COVID-19 related fatalities, and the yellow parts of the bars account for the suspect deaths, meaning that we are still waiting for the results to be conclusive, and those little yellow parts will eventually turn blue or disappear, depending on whether these suspect fatalities are confirmed or denied to be in direct relation with COVID-19. So as you can see, most of it is blue, means most of the fatalities have been either confirmed or denied. Here we have a different chart, but it is just here we can see how different states have different numbers of total fatalities. Now here we have a comparison between different pandemic curves. The first one is the highest curve, which concentrates all the cumulative suspect cases, regardless of whether they were confirmed later. All of those cases who at some point have been cataloged as suspect cases appear represented in this orange curve. Then we have the cumulative hospitalized cases that are represented through the green curve. We also have a curve for the hospitalized severe cases, which appear represented in the purple curve, and then the last curve, which is the one closest to the bottom, is for the critical condition patients. Now we have the pandemic curve, and here we're taking into account both the confirmed cases and the suspect cases. The former ones appear in red and the latter appear in yellow. So as you know, suspect cases are corresponding with cases that have been notified during the past few days. And because of that reason, we are still waiting to get confirmation of whether they are going to be integrated into the confirmed case statistic or into the negative case statistic. But it is important to keep track of these suspect cases because the tendency that we can observe regarding the suspect cases also allows us to understand the overall tendency of the pandemic in our country. So for example, if we only take into account the confirmed cases, we would be inclined to believe that there's been a slowdown in transmission or a decrease in the amount of cases, but this doesn't stand if we take into account the suspect cases, because then we know there is an important number of suspect cases that could be later confirmed to be positive cases. And finally, we have the overall general pandemic curve, which represents the total amount of confirmed cases so far in the country. That is 12,872 so far since the pandemic began. And on the yellow bars that appear at the bottom, we see represented the daily amount of newly confirmed cases in the country. And through observing this chart, we can also monitor the overall pandemic tendencies in our country. Thank you. Thank you, Dr. Alomía. Dr. Ricardo Cortés, you have the floor now.
Con mucho gusto, Dr. López-Gatell, muchísimas gracias.
Thank you, Dr. López-Gatell. Thank you very much.
What
I want to talk about now is the contact with the citizens that we have engaged in through different media. The first form of contacting and from establishing this communication with the citizens is the phone number that appears on screen, 800-0044-800, which is a special number for COVID-19 inquiries. So through this phone line, during the past 13 days, we've received 30,149 calls notifying of people who started exhibiting COVID-19 related symptoms. They were all provided with relevant orientation, and they were assessed over the phone to know if their symptoms were severe enough so they had to go seek medical attention, or if the recommendation was for them to stay at home. Also, when you call this number, there is an option you can select, which is for asking for emotional support. We know this whole pandemic, this whole situation has generated a variety of emotions in different citizens. So they go from fear to anxiety to anger. So we had over 7,000 calls that were related to emotional support. We also had over 7,000 calls of people who were reporting more severe symptoms, and they were redirected directly to an emergency line, to the 911 line, so they could have quicker and more effective orientation, and so they could be picked up by an ambulance should they need to go urgently to the hospital. Also, we had over 6,000 inquiries related to general information. These calls were from people who couldn't find enough information through other means, and they called this line and they were provided the relevant and the necessary orientation.
Google, Facebook y Twitter.
Now here we can take a look at the mobility data. This data has been analyzed by a group of by a team of scientists from CONACYT who have estimated that there's been a 57% decrease in mobility overall, community mobility overall in the country. But this information and this decrease is not only observable through this national index that was created using different data sources by the experts of CONACYT, but it also matches what has been reported at the state level in each state when it comes to observing the mobility levels. And the important thing is both the national and the state data shows that although there's been a general decrease during the past few days, during the last couple of days, there's been again an increase in mobility. So we want to reiterate that this is not over and we need all of you to continue to stay home. Also, let's talk about the chatbot that we launched a few days ago. Susana Distance, who is now available through WhatsApp for you to chat with her and for her to answer all of your questions. Since we launched this program, a total of 131,702 people have chatted with Susana, and 75% of those people have been satisfied with the responses that they have obtained. The 7 most frequently asked questions are: is it true that I have to shower right after I come back home and take off my shoes? If I have to go to the supermarket, what kind of measures should I adopt? If the pandemic continues to increase, will they close supermarkets? And questions of the sort. Of course, having a 75% satisfaction index means that we have a 25% non-satisfactory response index. So we are still working on improving the service of Susana Safe Distance and trying to close that gap and provide a better service for all of you. We have other channels of communication, for example, through technical releases that are available online or on social media such as Facebook, Twitter, or WhatsApp. And these releases and these visual recommendations and videos have been very successful in reaching the population. We have informed of the measures that should be adopted by the population, of the status of the supplies bought from China, and we even made a video that was addressed specifically at children to explain them the current situation. Now, thank you very much. We will be conversing also about an event that will be taking place April the 30th. Please, like any child, you must have a lot of questions regarding coronavirus. Oh, the video stopped. The video came back again. Well, basically this event that we're gonna have is called Ask Dr. Gattel, and it encourages children from all over the country to send a small video formulating a question for the Deputy Secretary. Dr. Gattel wants to listen to you, wants to answer your questions, and for this purpose we will be receiving the questions posed by the children in a video format of a maximum duration of 30 seconds, so they can also have a voice in these conferences. These questions will be answered in the conference that begins at 19 hours of April the 30th.
No habrá una presentación del comunicado técnico.
Because April the 30th is a day that is dedicated to children, we won't have a technical report on that day. The daily technical report is aimed at you, all the journalists, so you can do a better job, so you can be better at communicating with the public. But for that specific date, that specific hour of April the 30th, we won't be presenting any technical information, and we'll dedicate that hour to children. And we'll be talking about the most frequently asked questions by children. We'll be showing the drawings sent by children and the videos. The best videos, the top 20 best videos sent by children, will be selected, and we'll be contacting these children's parents so they can interact live, remotely with Dr. Gattel. So, as we know, that conference won't be a press conference, that will be the Ask Dr. Gattel conference. None of the children will be at the National Palace, of course, they will be interacting remotely from their homes with Dr. Gattel. Thank you very much for your attention.
Solo dos palabras sobre esto, mi agradecimiento para el equipo de la
And thank you very much
Jesús Ramírez, a Susana
to Jesus Ramirez, to Susana Pimentel, and all of the great team that has been working in collaboration with us for preparing this Children's Special Edition Conference. Because children are the hope of this country.
Sobre hoy, tuvimos una muy productiva reunión.
We had a very productive meeting in the format of a video conference with the state governors. And this meeting was led by the mayor of Chihuahua. We also had the participation of the co-president of this conference, Cesar Garza Villarreal. We also had the participation of Armando Quintero Martinez, who is also co-president. We also had Anabel Ábalos Empualteca from Tlaxcala, Enrique Vargas del Villar, who is co-president and mayor of Huixquilucan.
Francisco Javier Castellón Fonseca, co-presidente y alcalde de Tepic.
We also had Francisco Fonseca from Tepic. This meeting that we had was very productive, and the focus of these municipal presidents, we found it very stimulating and refreshing, because their focus is what is the role that municipal governments have to play in the control of this pandemic. It was very interesting because we have been talking repeatedly about the role of state-level governments and federal authorities in the control of this pandemic, but the municipalities, the municipal authorities also have a very important role to fulfill. That involves different responsibilities to the inhabitants of those municipalities. So thank you to Campos Galvan and all the presidents that participated for the opportunity of interacting with you and creating a sense of unity.
Let's go ahead with questions and answers.
Usted también, y usted que no le había tocado.
Yes, and then we'll go to the back.
No, allá la
Thank
compañera.
you. Good evening. I'm
Y
here
luego
from
nos seguimos allá.
Notimex.
Gracias. Buenas noches, Bianca Aguirre de Notimex TV. Ayer,
Yesterday at 4:57 p.m., an airplane arrived. It had 45 passengers on it, and it arrived to Mexico City. The doctors arrived with all sorts of different supplies, and I was wondering, are they here to help us with public policies, just like the Cuban doctors who arrived? Yes, this is work that is happening on behalf of the government of Mexico City. They've been working on this for months, weeks, because we have a serious deficit. We have of people to help us with this health emergency. We have incredible doctors and nurses, health professionals who are so valued to us all as Mexicans and to all of us who are involved in the health sector. This is something that we really, really appreciate. But unfortunately, we don't have enough. We have a deficit that we've calculated of, we need more than 200 health professionals at least to help us. And a number of organizations have commented on that, the OECD, the WHO. So when we started to deal with this pandemic, we realized that we were dealing with a challenge that was structural in our health system. We understood that we had limited coverage for health services, and that's because we had a lack of investment and a lack of training for personnel. So, what we're doing now is we're turning to all the options that we have to help us face and deal with this pandemic. So the Mexico City government has been collaborating because with Mexico City being hit the hardest right now, we're going to get help and advice from these people. They have a lot of advice, these people who recently arrived on the flight, and they are from Cuba, and they know all about public health, and they are extremely important to us right now. Now they've prepared extensively in terms of critical care. That's their specialty. These are these doctors' specialties. So we think that's really wonderful that Mexico City made that decision to receive those doctors. Good evening, everyone. Isabel Alvarez from Grupo Canton. Now, cadavers that haven't been identified, will those be going to a mass grave, an anonymous grave? And could you tell us how many doctors and nurses have gotten sick from COVID and how many have died? Yeah, Dr. Alomia will be documenting that. Now, about the people who have died, their remains, their cadavers that are not claimed. I mean, this happens in many parts of the world, but for many decades in Mexico has been an issue for many decades because of violence. So we're struggling with this pandemic right now, and this is completely relevant. We've been working with the Ministry of the Interior and the Ministry of Health to specifically understand what are the technical guidelines for the final resting places for these people's remains, because they cannot be cremated. If there are non-identified human remains and they have not been claimed, we cannot cremate them. Now, this has to do with guaranteeing that at any time we can continue with forensic investigations, and we might need those remains to do so. Or perhaps when people are searching for missing persons, those remains might match up with someone who's missing. Now, as Dr. Alatorre was talking about recently, we were talking about burial for unclaimed bodies. For years now, we do have spaces allotted specifically for those people's remains in a common grave area, and that's where we would be putting those people's final resting place to be. Regarding the second question, there are 1,934 people who are health professionals and have gotten sick from COVID. 70% of those people have been doctors, and 5% nurses, 15% from other health professions, and 2% have been dentists. That is the information we have on health professionals up to now.
Luego nos vamos a la fila de
You,
atrás.
you, and then you in the back.
Gracias, doctor. Celsin Juárez de
Thank
Celin
you,
MX.
Dr. Sergin
Me
Juarez
gustaría saber
from
cuáles son los
Celine
alcances en las
MX.
disposiciones del
I
gobierno
would
federal
like to
sobre el
know
cierre de las
exactly how
actividades
willing the
de las
government
empresas con
is to
actividades
close
no
down
esenciales.
activities for
Se han comunicado con
companies
nosotros
that are
trabajadores de
non-essential.
una empresa que se dedica
Now,
a la
there are some
fabricación y
workers from a
venta de
company that
analizadores de vibraciones para
manufactures
la industria
and
automotriz
creates,
que no cerraron al no ser una empresa de
who works related to the automotive industry, and they say that they have them in the laboratory, in the factory. They work there, they cook there, and they've been there since phase 2. Does this have to do with the Secretary of Labor, or because they're saying that a lot of people would like to register a complaint, but they're afraid of being fired? So I'd like to hear your comments on this discussion, since you are the person, sir, who has been calling business people to have solidarity with their employees, and especially now in phase 3, for them to be closing down this activity. And this is not the only company that is continuing to operate. Thank you. I'm just wondering if that report that you were sharing so courteously with us, if those were people who had been installed in the company's factory against their will? No, they're not there against their will. They're not being held against their will. They have just told us, they've told us it's not really that great being there. They said that their bosses told them to come and they don't have any other choice, that they have to be there or else they're going to lose their jobs, and they're afraid to lose their jobs. Okay. Well, if they are agreeing, if they're doing it of their own free will and they're adults and they can do what they like of their own free will, then I guess that's what's going on. If that's not the case, then that's a crime, because they're being held against their will. If they're physically being held there, then that is absolutely scandalous. But if they are being coerced, if they're being made to be there, not allowed to leave that factory, then I guess that would be a crime. So in general terms, yes, we continue to struggle with and deal with resistance from the business sector. Small businesses, medium, some small businesses, and even some very big businesses. Now, what this us is that they are not willing. The people who have the decision-making power, the general managers or the owners, the shareholders, all of these people, all of them, the shareholder meetings, for example, they are participants, and they're responsible for not going against official messages that are backed up by the Constitution to protect one of the most important, maybe the very most important thing, which is people's lives. So there's no doubt that what this represents is an attitude that is just one of the worst crimes. That's how simple it is. And when we see this as an issue of public interest, for example, where all of you people who are watching us and listening to us and learning about this, and next Monday, we're going to present on this at a specific session called Who's Who in Fulfilling the Health Measures, so that we can all protect each other from the biggest pandemic in the last 100 years, with catastrophic consequences in the whole world, to protect our lives, our health, and, well, the economy. Well, we're going to find out who these companies are, who are going against health, the rules, and the economy. The businesses who have non-essential activity, what they're doing is they're going against the controls that we're trying to put in place to control this pandemic. And there's a consequence, and that's going to hit the world economy. I'm not saying that the only contribution, I'm saying one of them is that this behavior of these companies is really affecting this. When we look at technical and scientific evidence that backs up our decisions and the decisions we've made, well, we have studied economic models to understand what are the factors that are going to come into play in terms of the damage to the economy and how we can kind of look at those as opportunities in the future. I'm really glad you mentioned this. This is something that we have also placed in the hands of different levels of government. For example, the Ministry of Labor, they're doing inspections according to the law, and they're seeing what are the labor conditions, picking up on that. But it's also relevant in terms of health of workers who are the health of workers who continue to work right now. We know that there are people who are working right now and that they are affiliated or they should be affiliated with Social Security. So we can see a relationship between the companies who have not stopped their activity and these workers and the need that they have to use IMSS, Social Security health services, and the damage to these people's health, not to mention the economic consequences. Now, COFEPRIS, the National Commission for Protecting Against Health Emergencies, has the legal framework in order to do inspections and to identify people who are violating health protection measures that we've put into place. And this could also be a crime, and they could be sanctioned, maybe economically with money, or they could be shut down. And then we're going to the back. I'd like to ask you, today an agreement was published in the Federal Official Gazette that said that health institutions could hire foreign doctors to be working during this health emergency. I'd like to ask you if you have a goal of how many foreign health professionals can be hired, and if you have hired them, how many have you hired? And then for this report for businesses that is going to be presented on Monday, do you have information about what companies have been sanctioned or who has received a sanction or a fine for not fulfilling the requirements? Yes, that has to do with the question that Bianca from Notimex posed. There is no plan. We don't have a predefined plan for the number of people, the number of foreigners we're going to hire. The same as we have done with the whole retrofitting of hospitals and services and all of that. That's been going on for about 6 weeks. And we have been, accessing any resources that we have available, including the private sector. We're also taking a look at other facilities to house patients to make sure that they're up to snuff. Accelerating this appeal, asking for health professionals, we're going to be speeding that up now. We're going to be asking all health professionals, especially specialists in areas, infectologists, critical care, health professionals. We're asking for nurses. We're asking them to sign up in this well-being call to convene, to get together. We're asking them to join us. I don't have the exact number, it's being updated. But we have had good progress with that call for health professionals. At the beginning, if we had had a response, a broad, wide-ranging response to this from Mexicans, we wouldn't have to ask for foreigners because we'd have enough here. In Mexico, Mexico. Unfortunately, the case is that we don't have enough health professionals in certain fields. And then in other cases, we haven't had that appropriate response in terms of numbers that we've been looking for.
¿Cuál era su segunda pregunta?
Sorry, what was your second question? I wanted to ask you in what areas or medical specialties? Oh, yes, in the subspecialties, critical care, infectology, pneumonia. Those are the three main specialist areas where we don't have very many Mexicans. Now, if we aren't able to get enough health professionals, how many could you possibly hire from other countries? I must insist I don't have a number. We're going forward on a whole bunch of things all at the same time. And also Dr. Alejandro Batz, the coordinator of the medical area at INSABI, the Institute for Health for Well-Being, has been saying that we had him working along with this Salvador Subridan Hospital and as the subdirector of critical care at that other institute, and that we have a pyramid scheme of supervision where one person is a leader in their specialty, for example, in critical care, and they directly train 5 people who don't necessarily have a subspecialty in that area, but who are related, and then they supervise another 5 people. So we have a sort of a pyramid of 25 people, and in that way, we're optimizing, taking advantage of each specialist that we have. Do you have information about how many companies have been sanctioned? We're going to present that with the who's who. We do have that, but I don't want to, get to give out information
Hola,
ahead
buenas
of time.
noches. Andrea Meras de Grupo Fórmula.
Hello, good
Hoy
afternoon.
en
Bea
el
from Grupo Fórmula.
mañana, la jefa de gobierno Claudia Sheinbaum
This
indicó que el
morning,
70%
Claudia
de las personas que
Scheinbaum,
están
head of the government,
intubadas son
said that of
ciudadanos
the
de la
people who are
capital, el resto son del
intubated,
Estado de México
most
y
of
otras
them are from
entidades.
Mexico
Si nos
City,
pudiera
and then the
decir
rest are from
por
the
qué
state
se
of Mexico
están
and other states.
trasladando
Why
justamente de
are
otras
you
entidades aquí a la
transporting
capital, si es por falta de
people from
recursos
other states to
o
here at the
también
capital?
cuántas
Is it because
personas
of
de
lack of
otros estados están
resources?
llegando
Why
aquí a
are
la ciudad para
people
atenderse
from
y no
other
precisamente
states
se contabilizan
arriving to
en sus
Mexico
estados, sino que
City?
llegan al
Why
interior
aren't they
del
being
país quizá a
treated in
buscar
their
un
own
mejor tratamiento.
states?
Primer
Maybe
sentido,
are they
primera
for better treatment here in Mexico City? Well, maybe there are cases, for example, some of the ones that you're talking about, that people who travel to Mexico City to get treatment, but that's not the rule. That's the exception. Now, the head of government of Mexico City, Claudia Scheinbaum, was talking about when you identify the number of people in intensive care and they're on ventilator, the majority, 70%, are residents of Mexico City and the metropolitan Valle de Mexico area. So there is definitely an active flow of coming and goings for people who are residents of the state of Mexico or, right in the Mexico City itself. So it's not that the whole country is coming to Mexico City to get treatment. As I was saying, as the data speaks for itself, and it says that there is an intensity moment which is happening right now, especially this Valle de Mexico area. My second question is, private hospitals have put posters in their windows where it says they can't receive patients. Had you foreseen that situation? Can private hospitals do that? Can they turn people away, like at the Hospital Español? Because they were saying something along those lines. Now, will there be a new agreement with private hospitals so that they can treat other people? Because in the capital, as you say, the statistics are showing there's a higher number of cases here. Yes, that's the scenario that we had that we had foreseen. And right now is the moment when we have this accelerated progression of the number of people daily who are sick. We must insist that you stay at home, because if you're at home, if we're all at home, if we all stay at home, whoever is not doing an essential activity and who isn't going out into public areas, if you stay at home, we are going to lower the number of people who are infected. This is phase 3. We've been telling you since January. We've been telling you it's going to go up fast, 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 fast. The most important consequence is that, if we have this oversaturating hospitals, then we're going to, we knew that was going to happen, but we retrofitted the hospitals to make more room. And we had the plan N3 with the Navy and with Sedena, and we incorporated 30% more capacity. And then we have the private institutions, and we increased another 15% our capacity, our beds. So when internally the hospitals started to get organized with each other and to put aside surgeries that are not necessary, and we saw that they had reconverted to deal with this higher need. And then we also have even more expansion coming from the Navy. They retrofitted other areas, other facilities, other hospitals. They expanded even more. And when the head of the government made an agreement with the private sector to convert the Banamex Center, it expanded even more. But if we don't stay at home, the number of cases is going to continue to increase and increase and increase, and the hospitals are going to be so oversaturated. For example, the Hospital Español is now at capacity. They're at the limit. I got a message from my very good friend, an infectologist, Dr. Jose Luis. He's at the head of infectology at that hospital, and he shared that with me, that they are saturated. The critical thing here is that everyone has to be able to have a place to get treatment, to get care. So we need to work on redistributing things. Now we have hospitals in Mexico City that are the government of Mexico City hospitals. We still have a space there, but it's critical. We need to work on this. We also have another agreement that's about to come into force. And health institutions like IMSS, ISSSTE, PEMEX, CEDER, CEMAR, the Ministries of Health, this is an agreement that temporarily they're going to be able to help each other and redistribute patients from one place to another. Is that going to help people get admitted faster? Right now, what's important is with this agreement signed, and the Hospital Español is part of that agreement, we have to leave the necessary space that is dictated in the agreement. And there are still many other health conditions that daily are being attended to right now, so they need room for them too, those procedures. We have 3 minutes left. Exactly like my colleague was commenting, there are phone calls from people who, I'm going to explain this to you. Like, for example, hemodialysis, they can't get it anymore. They're not getting it at their private hospital, and then they're sending them back to their clinic. And then they're saying, oh, well, I'm sorry, we can't treat you because the hospital is full of COVID patients. Is that in the agreement that they wouldn't be taking on these people? That these types of contingencies are going to be popping up? My other question that I wanted to ask you, what strategies do you have with doctors so that they don't suffer, or in case they do suffer from burnout, with all the stress that they're experiencing, what are we going to do with these doctors? How are we going to help them? How are we going to support them? And all health professionals. Oh, thank you for those questions. About the first one, the agreement stipulates the limits for operating for hospitals in the private sector who can participate. But yes, someone who needs hemodialysis has other health conditions that could also require attention. So for people who use hemodialysis services, apart from the fact that they have chronic diseases, some of them also have other conditions that require immediate care and attention. So the hospital and the subsystem, it's not just a hospital. Yes, they must attend to them, and they will. They're sending them back. We need to analyze those specific cases. You know that these conferences are also to report and point to what's going on. Please bring us specific information. This same patient, can they make a complaint? If it's for social services, yes. Yeah, I don't know from what institution you're talking about. Please let me know. Yeah, sure. The phone numbers are there. We have the outreach coordination at that Social Security Institute. Now, about health professionals and what's happening with burnout. Yeah, this we've had a very, very talented team that has come here a number of times. Dr. Juan Mel, Dr. Ramirez, Dr. Robert Savicki, Dr. Jorge Gonzalez Arvira, and we're going to bring them back here too. We're going to have them back to talk about these preventive measures. Yesterday, the National Psychiatric Institute, Ramon de la Fuente, they made a number of telephone numbers available so that people can call, so that they can get information. And also Dr. Ricardo Cortes, number 844-800, people can call and there's a menu there on the telephone system, and you can get information right there, right at that phone number. And if it's an emergency for mental health, that's going to go straight to 911. So we do have a network of support. We are going to deal with that. Our health professionals, especially the clinical areas, they are facing insane stress right now and physical fatigue. But we're still, a couple of weeks away from hitting the peak. So I must insist that you stay at home for the mental and physical health, the emotional health of our health professionals. This would contribute to the collapse of our system if these people get burnout in our health professionals. All of them have that amazing ethical, moral, professional commitment that we all know them for. I'm going to leave you now at 7:59 and we'll continue tomorrow. Thank you.